It is difficult for parents to not worry if their child has fever. But fever in children is normal and is mostly part of the child's defense mechanism against infection. Fevers are usually not dangerous in toddlers and preschoolers, but for a young baby, it is a cause for concern, and maybe because of something more serious. Among preschoolers, fever is a way for the body to fight against infections. Macrophages, which are the cleanup cells in the body, are always on the lookout for bodies which do not belong. When they find anything such as a virus, bacteria or fungus, they try to remove as much as they can. For the rest, they signal the brain to raise the body's temperature. This way, the heat kills some of the bacteria. The heat also speeds up the production of white blood cells and chemicals in the body that kill germs. After immunizations as well, a lot of young children get fever. Some of the other common reasons for fever are colds, flu, sore throats, ear infections, respiratory illness like pneumonia, and viral illness. There are numerous reasons why children end up getting fever, and most of the times the cause is unknown. It is just a part of growing up.